a big welcome back to the G2Z online event series. Thank you very much for joining us today. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders. I'm lucky enough to be speaking to you today from Taungurung country. Let us know in the chat which land you're on today. My name's Nell Thompson and I'm the coordinator of the National Getting to Zero, or as we call it, G2Z program. I'll be hosting the webinar for you today. G2Z was developed by the Animal Welfare League of Queensland and they continue to support it to this day. G2Z offers its consulting, support and educational services at no charge to local governments and not-for-profits across Australia. Our focus continues to be on companion animal welfare and management issues such as strategy, legislation, operations, programs, and community engagement, working towards reducing intake to pounds and shelters and keeping pets in their homes. We invite people to take a look at our website at g2z.org.au, sign up for our regular e-news, connect with us via social media, and to get in contact with us to see if we can help or to have a chat about the issues that are facing your community or organisation. And so to today's session. Once I hand over to our presenters, there will be around 50 minutes of presentation and around 10 minutes of question time once the presentation has concluded. The recording of this webinar will be accessible via our website to everyone to watch at any time. We're going to ask that everyone mutes themselves during the presentation unless our presenter indicates otherwise. And if you have any questions, you can start putting them in the Q&A section and we'll get through as many as we can at the end of the session. If you have very quick questions that relate to your understanding of the content, put your hand up. There's a button down the bottom of your screen and we will try to get to them during the presentation itself. As always, please excuse any working from home background noises that may filter through. I'm very happy to introduce Casey Quimby and Dr. Jessica Hoops to you today. I met Casey back in 2013 when she graciously agreed to come to Australia from Fiji and present at G2Z 2013. She's continued to blow me away with her work and accomplishments since then. She's an American Fijian with nearly 15 years of experience operating a shelter and multiple veterinary clinics throughout Fiji. She's been a pivotal figure in the region's animal welfare efforts and has earned her master's certificate in shelter medicine from the University of Florida in 2018 and has been at the forefront of data collection and population management in Fiji over the past 4 years. Her dedication to developing evidence-based, research-informed strategies has significantly contributed to sustainable and humane solutions for companion animal management in local communities. Jessica and I have not actually met in person yet, but we work together frequently and she's an incredible resource to have here in Australia. She's a Canadian veterinarian with over 10 years experience working in veterinary and shelter medicine and animal management in Canada, Fiji, Papua New Guinea, Costa Rica and Australia. Her experiences working in the Pacific Islands have underscored the importance of developing evidence-based, research-informed strategies for addressing free-roaming cat and dog populations that are tailored to the needs of the local community. While currently working as the One Health Research Coordinator for AMRIC, she has spent the last 5 years remotely supporting rescue groups in Fiji in developing a framework for baseline data collection with the hopes of informing sustainable and humane solutions for companion animal management. Over to you, Casey and Jessica.
Thank you so much, Nell, and thank you to Getting to Zero for having us. As Nell said, my name is Casey Quimby. I'm co-founder and managing trustee of Animals Fiji. I'm with our associate researcher and my colleague, Dr. Jessica Hoops. Thank you very much. Just a little bit about Animals Fiji. Animals Fiji is a US and Fiji registered charity with a focus on animal welfare. We've been operating since 2011, relying on donations and subsidized fees. We offer basic treatment for pets, livestock, and wildlife. We operate 4 veterinary clinics in Nandi, Lautoka, Savasavu, and Lambasa. as well as outreach programs for underserved communities. We operate a small shelter in Nandi for stray, injured, and abused animals, providing treatment and rehoming services, and population management planning, including spay and neuter programs. Animals Fiji impacts animal management through extensive treatments, rehoming services, and outreach, as I mentioned, in Fiji's Western and Northern divisions, which is a human population of about 600,000. In 2023, Animals Fiji performed 2,043 sterilization surgeries and helped over 6,000 animals. Our presentation today takes us to the Democratic Republic of Fiji, a small island nation in the South Pacific, which some of you have maybe been to. Like many low and middle income countries in the world, free roaming dog populations are ubiquitous to cities, towns, and villages throughout the country, and managing their populations presents ongoing challenge. The COVID-19 global pandemic and subsequent lockdowns presented significant challenges for animal management, severely limiting our ability to carry out routine sterilizations within our clinics, and even more so for outreach programs. Therefore, it severely hindered our population control efforts. While free-roaming cat populations are also in existence, they're often excluded from open public areas by the resident dog population, and really their need to manage these populations has not been fully realized. While the true prevalence of free-roaming dog populations in Fiji is currently unknown, the magnitude of the problem associated with free-roaming dog populations across the country is really well documented in social and conventional media. Nationally, the principal motivations for dog management are centered around dog-human conflict and predation of livestock. Dog attacks, bite injuries, and reports of fear caused by aggressive behavior of dogs has been widely reported in mainstream media and prompted emergent reflex interventions to manage these populations. More recently, growing reports of dog attacks on local livestock have sparked public controversy around dog management, with farmers calling for immediate action to address these, which leads to devastating losses of the cattle and goats at the hands of quote-unquote wild dogs. For animal welfare groups, concern around the health and well-being of the animals is also driving the efforts for sustainable long-term solutions to managing the stray and free-roaming populations. Some of the main welfare issues observed in these dogs include malnutrition, infectious diseases such as parasites, leptospirosis, parvovirus, TBT, and animal welfare issues imposed by human-dog conflict, such as injuries caused by fighting, cane incidents, road traffic accidents, and abuse of treatments such as poisoning, scalding, and beating. Given limited resources and funding to find sustainable solutions to managing the free-roaming dog population, historical management practices have centered around culling and indiscriminate baiting of dogs. Paraquat was commonly used throughout the country to manage the roaming dog populations until 2020, when its use was banned due to health and safety concerns. The poison has since been replaced by the use of sodium fluoracetate, more commonly known as 1080. Unsurprisingly, given that management strategies focus on culling as a primary means of population control, it fails to address the source of the new and replacement animals and can lead to reflex breeding. These approaches have done little to address roaming dog populations across the country. The use of poison, particularly paraquat and 1080, has been highly controversial due to the severe suffering it causes to the animals. These methods have raised significant animal welfare concerns. On the other end of the spectrum, efforts from animal welfare groups have historically focused on animal sheltering and rehoming and improving access to low-cost veterinary services. The first animal shelter was established in 1953 in the capital city of Suva, and its efforts in slowly expanding across the mainland of Viti-Levu with the second establishment of a shelter, Animals Fiji, in 2012. There are now 3 animal shelters in Fiji that house between 40 and 150 animals each, and they have veterinarians on staff. Additionally, there is a dog sanctuary at a self-proclaimed capacity with close to 300 dogs. It's important to mention that there are also unquantified number of individuals across the country providing rehoming efforts through informal rescues within their home. Unfortunately, most of them are unable to provide consistent veterinary care or even sterilization. However, despite this growth in sheltering resources of over the last 10 to 15 years, the number of homeless animals presenting for intake consistently exceeds the adoption-driven capacity or of existing animal shelters. Owners rarely come forward to reclaim their animals, resulting in many animals facing prolonged durations in the shelter system, with considerable costs associated with maintaining animal health and well-being in closed shelter environments. Like indiscriminate culling, sheltering and rehoming facilities address only the symptoms of dog overpopulation. And without high probability of reunification of adoption, reliance on rehoming centers on both inefficient and expensive means. It can also compromise animal welfare in the shelter capacity if it is consistently exceeded its capacity for care. We must now reflect on the path that we would like to take and focus on animal welfare in Fiji, whether to pursue shelter-focused population control or address the root cause more fundamentally. At the 2024 ICAM conference, there was a presentation by Katja Guthrer and Kristen Hasen based on their paper titled Coming to Terms with the Legacies of the Pound Model in Animal Sheltering in the US. They explore the historical developments of animal control and sheltering in the United States and its impacts on modern public shelter systems. Despite reforms that have reduced animal intake and euthanasia, contemporary sheltering still reflects early practices from the late 1800s and early 1900s. Key enduring legacies include culture centered around caging and housing of dogs, lack of transparency in government shelters, economic disparities in shelter resources. So understanding these origins helps explain current practices in both the US and abroad, and provides a foundation of envisioning significant changes in animal sheltering. This is important to note because we can learn from others and adapt the tools that we are using to create a more hybrid version of animal sheltering and population management developments. Animals Fiji started doing trap, neuter, release, and return and outreach desexing clinics in 2012. Over the 12 years, our outreach at Animals Fiji has grown drastically to up over 25 outreach clinics a year. Outreach clinics are starting to also be carried out by other animal welfare organizations in Fiji. However, with all this growth, it still seems that we are not getting the focused impact we need for lasting change. Although many of these programs have had considerable collaboration from animal welfare groups, local government, the Ministry of Agriculture, local and international universities, limited resources, and a lack of clear direction have resulted in predominantly low volume programs, so under 200 animals, with ad hoc service delivery focusing on dogs in urban areas only. Furthermore, there have been limited efforts to monitor the impact of these programs in reducing the size and impacts associated with roaming dog populations. So it's nearly really impossible to determine if the tremendous efforts being undertaken by the animal welfare organizations like us have actually come at considerable costs associated with these programs, and are they actually effectively contributing to the decline of free roaming dog populations? Generally, there is a threshold value for desexing that is required to effectively stabilize or decrease the size of a roaming cat and dog population, below which the population continues to grow and carry the capacity of local environments. While desexing may have health benefits for the individual animal, unless this threshold value is reached through high volume spays and neuter activities, these efforts are unlikely to lead to sterilization of free roaming dog populations. Additionally, activities from expat or outside country organizations are often not well coordinated with local efforts, which can lead to fragmented and less effective outcomes. More recently, animal welfare groups have been advocating for the need to develop humane dog population management programs that address the root cause of dog overpopulation, centered around desexing and the promotion of responsible ownership to bring sustainable changes in dog population. In line with the ICAM principles, to be successful, dog population management strategies must be based on an understanding of the size of the demographic of the roaming dog population, as well as ownership practices and other drivers of sustaining the size of the dog population to identify specific goals for the intervention. As part of our baseline data collection, we aimed to target household questionnaires to determine the size, demographic, welfare, and dynamic possession, acquisition, abandonment, roaming, reproduction, community care, and death within the dog population, and develop a better understanding of the knowledge, attitudes, and practices surrounding dogs and dog ownership, which may contribute to the maintaining of the population. Our pilot study focused on the city of Lautoka in the northwest side of Viti-Levu, Fiji's largest and most populated island. Lautoka is Fiji's second largest city after the capital in Suva, and its close proximity to our Animals Fiji main clinic and head office. Lautoka City is divided into 4 administrative wards: Vitari, Tavakubu, Simla, and Waiavi. For the purpose of our baseline data collection and street dog counts, the city was divided into 7 discrete neighborhoods, as shown on the map on the right, using the ward boundaries and enumeration zones. Tavakubu ward, one of the most densely populated areas of the city, was randomly selected as the location for our initial pilot study, with hopes of developing framework of baseline data collection in other parts of Lautoka and across the country. Today, we will be presenting the findings of our door-to-door survey across Tavakubu. A structured household survey was developed to assess the demographic of the owned population, as well as the public knowledge, attitudes, and practices towards the dogs and dog ownership, modeled after the ICAM guidelines and the thesis by Dr. Jasmine Dillon. The households questionnaire was delivered in a door-to-door survey that was carried out across Tavakubu between the wards of July 12th and the 7th of September. This survey was administered verbally by trained volunteers, and the survey was online platform with Survey Planet using portable tablets. Household sections were determined by the following roads along pre-established driving routes that we use to conduct street survey counts, another part of baseline data connection study. Every 8th house along the route was approached for interview. I'll now pass it over to Dr. Jessica.
Hey, everybody. So from the study, a total of 262 households were approached to participate, of which 219 households, or about 84%, agreed to be interviewed. This is equivalent to approximately 7.4% of all the households in the area, according to the 2007 survey data from the Fiji Bureau of Statistics. 37% of households in the area reported owning at least one dog, with pet and companionship at 55% or guarding and protection at 44% being the primary reasons for dog ownership. A total of 118 owned adult dogs and 40 puppies under 1 year of age were reported across all respondent households, averaging about 1.9 dogs per dog owning household, or 0.6 dogs for all households across the ward. Based on the available human census data, the ballpark estimate of the owned dog population in the area would be about 1,600 owned adult dogs and 237 puppies. The majority of dogs were obtained either as a gift or a free dog, so about 51%, a stray dog, 44%, and other things. In contrast, only about 5% of the dogs were adopted from a shelter, despite the fact that this area has really close proximity to the Animals Fiji's main shelter facility. This suggests that while members of the public are contributing to rehoming of unwanted and free-roaming dogs, they don't appear to be doing so through formal pathways for adoption and rehoming. The majority of owned dogs were male at 58%, with a male to female ratio of 1.47 to 1. Overall, we found that survey respondents seemed to be aware of responsibilities associated with dog ownership, with 99% of all respondents agreeing that dog owners are responsible for keeping their pets healthy and happy, and 100% of respondents agreed that if a dog has puppies, it's the owner's responsibility to care for them. In spite of this, real-world application of responsible pet ownership practices was pretty limited. So despite the fact that 99% of all households acknowledged that vaccination was important for keeping dogs healthy, only 76% of households had never actually vaccinated their dogs. Similarly, for flea and tick prevention and deworming, 73% of households had never given these treatments to their dogs. For confinement, 56% of all households disagreed that dogs should be allowed to own freely, but only 48% of dog-owning households kept their dogs confined to a house or yard throughout the day and night, indicating that a significant portion of the owned dog population is allowed to roam freely for at least a portion of the day. In Fiji, it's also important to note that dog licensing is mandated by law for all dogs over 6 months of age. And while 98% of survey respondents agreed that dog owners are responsible for making sure their pet was licensed, only 5% of households reported having all the dogs they owned having a valid license. Looking at desexing rates, although almost 84% of our respondents agreed that dogs should be desexed to prevent unwanted puppies. Only 13.4% of all dog-owning households reported having all their dogs desexed. Only 22.4% of all owned adult dogs with a known gender and desexing status were reported to be desexed, and with female dogs being about 1.65 times more likely to be desexed than male dogs, so more female dogs getting desexed. The main reasons for not desexing included not knowing it was important, with over half of respondents saying that, and cost at about 16% of respondents. In terms of fecundity or reproductive success, 28% of dog-owning households reported that at least one of their dogs had given birth to puppies in the past year. Looking only at those households that had intact female dogs, 78% of households reported having at least one female dog giving birth to puppies in the past year. A total of 103 puppies were born to respondent households in the past 12 months, with an average of about 5 puppies per litter, which is quite high. The majority of households reported that these puppies were either given away, so about half, or died of injury or illness after birth, so about 28%. The remainder of puppies either died from unknown causes, were killed by their mother, or were poisoned. Just a bit of a sad state of affairs. While dog ownership is quite low, 54% of all the households reported feeding or providing care to at least one dog on a regular basis that they did not consider to be their pet, with a range of 1 dog to more than 10 dogs being fed by households, and an average of about 2 dogs being fed per households across all of the households surveyed. 62% of the households that reported feeding dogs did not report owning a dog. And although the households that agreed or strongly agreed with the statement, "I like dogs," were more likely to engage in caregiver behaviors with an odds ratio of about 2.5, nearly 20% of the households that reported feeding dogs disagreed or strongly disagreed with the same statement. As such, the motivations behind this kind of behavior are quite multifactorial and require further investigation. Survey data substantiated concerns from mainstream media about dog bite injuries, with quite a high amount, 6.4% of all survey respondents indicating that at least one member of their household had been bitten by a dog in the past 12 months. 35% of the bite victims were children under the age of 12. Unknown or strange dogs at 41%, stray dogs at 35%, and the neighbor's dog at 24% were the dogs that were found to be responsible for inflicting the majority of dog bite injuries. Overall, we found that survey respondents acknowledged that free-roaming dogs were a population both across Fiji at 92% and within their local neighborhood at 92%. 91% of respondents agreed that dogs should be treated with the same amount of respect as human members of the family, and 56% felt that the community was responsible for caring for street dogs. Support for indiscriminate culling and baiting type approaches was actually quite low, with only 6% of respondents agreeing that this kind of method was an acceptable way to approach population control, and 93% of all respondents saying that it was not acceptable to kill dogs. In contrast, 78% of all our respondents agreed that street dogs should not be allowed to breed, and 71% disagreed that desexing to prevent unwanted puppies was cruel and inhumane. Sorry. I will pass you back to Casey to go through a discussion of those results. Casey, you're on mute.
Sorry. Thanks, Jess.
No
So
problem.
despite the widespread understanding of the importance around the basic tenets of responsibility, pet ownership, including sterilization, dog licensing, provision of preventative care treatment, confinement, adherence to these recommendations of dog owning households was really low. As effective dog population management strategies can need to drive change in human behavior, it is likely that current approaches are not having the desired impact on promoting responsible pet ownership practices by the dogs in Tavakubu ward. Further research and community engagements are needed to better understand the real and perceived barriers to responsible pet ownership and determine the appropriate strategies to improve responsible pet ownership within this community. Our results provided pertinent insight into the impacts of human behavior in maintaining the stray roaming population in Fiji. Low desexing rates, high fecundity, and the large number of puppies being born into dog-owning households in conjunction with limited confinement of owned dogs is likely to be contributing to the dog roaming population. However, relatively high mortality of puppies due to disease and injury after birth may also offset some of this in that regard. Limited confinement can also makes it likely that a substantial portion of the roaming dog population is comprised of owned dogs that are allowed to roam freely, which has important implications for management of free roaming dogs, particularly the use of indiscriminate culling practices. At the same time, our study demonstrates the magnitude of caregiver behavior and indiscriminate feeding of free roaming dogs in Tavakubu and provides pertinent insight into the complexity of potential motivations behind these behaviors. Without concurrent desexing of community-owned dogs, it is very likely that this subpopulation is primarily a primary contributor to the sustaining of the free-roaming dog population. With well-intended feeders, providing these dogs with sufficient nutrients to survive and reproduce, giving rise to more unwanted puppies and perpetuating the cycle. Results of the study indicate low support for lethal methods, such as for population control, which mirrors reports in mainstream media, suggesting considerable controversy of the use of baiting to manage free roaming dogs. Our results also suggest that local communities may be less inclined towards rehoming and adoption as a primary method of population control. In contrast, there appears to be a broader support for desexing of both owned and free roaming dog populations to reduce the number of unwanted puppies. Given the relatively low desexing rates and evidence of community support for reproductive control as a strategy for controlling the roaming dog population, high-volume desexing programs with a focus on promoting uptake of these services by caregivers who are feeding strays and roaming dogs may be an effective strategy for addressing the roaming dog population and is well aligned with community preferences. Ongoing monitoring of this size and dynamic of both the owned and free roaming dog population and ongoing evaluation of the local public knowledge, attitudes, and practices is critical for ongoing evaluation of this dog management interventions. We need to also drive members of the public and municipalities and the Fiji government to understand that dog and cat populations is a social problem with human behaviors identified as the root cause. In other words, dog overpopulation results from human behavior. Therefore, successful dog population programs must change human behavior. Promoting and having action of responsible pet ownership can significantly reduce the number of strays, dogs, and diseases that are contagious to humans. Results of our study that ownership apathy and indiscriminate feeding may be a significant factor contributing to the stray and free-roaming dog populations in the Tavakubu ward. Ownership apathy refers to lack of responsibility among dog feeders, where individuals provide food but take it no further for any responsibility for their overall care, such as ensuring proper shelter, vaccination, or sterilization. Indiscriminate feeding, on the other hand, involves feeding dogs without considering the consequences, which leads to unchecked breeding, subsequent increase in dog populations. These behaviors worsen with free-roaming dog populations, contributing to the growth of the strayed population, making it more challenging to manage and control the spread of disease that can affect both humans and animals alike. Some basic and broad ways that the crisis can be addressed based on our research so far is number one, responsible pet ownership. This remains crucial for addressing the dog and cat populations. Pet owners must provide comprehensive care, including feeding, shelter, healthcare, and emotional support. Sterilizations through spaying and neutering. This is essential for controlling the pet population. These efforts prevent unwanted litters, reduce the number of stray animals, and lower disease and behavioral issues. However, a disconnect exists. While the importance of desexing is often acknowledged, it's not always translated into action for various reasons. Number three, educational campaigns and awareness programs. Workshops, community events, school programs can educate the public on pet care, sterilization benefits, and pet ownership responsibility. These initiatives foster a community committed to responsible pet ownership and help reduce pet population. However, addressing apathy is a challenge. Traditional education approaches might not be enough to ensure consistent uptake of these programs. As well, there are impacts that take a lot more time than acceptable to the community, government, or private sector. To do such programs, resources are needed. Resources for program implementation have to come from either the community itself, the local or national government, or other NGOs, both domestically and internationally. We keep mentioning responsible pet ownership. But what does that actually mean? Responsible pet ownership encompasses a comprehensive approach to caring for animals, ensuring their well-being and addressing their needs from multiple dimensions. Traditionally, we might visualize responsible pet ownership as a dog securely behind a gate or inside a home, with various aspects of care meticulously attended to, like basic needs, providing food, water, shelter, healthcare, regular veterinary checkups, vaccinations, preventative care, and treatments for illness or injuries, training and socialization, teaching pets appropriate behavior and helping them to adapt to different environments and situations, exercise and enrichment, ensuring a pet gets physical activity and mental stimulation to keep them healthy and happy, grooming, regular cleaning and maintaining of the pet's hygiene, such as brushing, bathing, and nail trimming, safety, keeping pets safe from hazards and ensuring that they are properly identified with microchipping or collar, emotional well-being, providing companionship, affection, and attention to meet pets' emotional needs. It's clear from the data that we need to reframe responsible pet ownership beyond these Western perspectives. While these elements are found in many ways in Western contexts, it's important to recognize that responsible pet ownership can look differently in various cultural settings. For instance, in some regions, pets may have more freedom to roam. This freedom can provide valuable stimulation and social interaction that some urban pets may miss out on. Considerations for different contexts in places like Tavakubu and broader for Fiji, cultural variations in cultures where free roaming dogs is common, pets might have more opportunities for natural behaviors of socialization and environment enrichment. This can still sometimes compensate for aspects of care that the owner might not be able to provide in Western settings, or Western standards, sorry. Sterilization and healthcare, certain elements such as sterilization remain universally important in preventing overpopulation and maintaining a health of an animal. Responsible pet ownership in any context includes that they are spayed or neutered and receive the necessary medical care for this. And then behavior enrichment. For free roaming dogs or pets, the environment itself can provide stimulation and opportunity for natural behaviors, which might be more challenging to replicate in confined setting. However, this should be balanced with consideration for health and safety. By acknowledging and adapting the different cultural practices while maintaining core responsibilities, we can develop a more inclusive and effective approach to what pet ownership means, and that respects diverse ways of caring for animals while ensuring their well-being. Given the ways that we can address the crisis, we need to rethink how charity is done. In Lupton's 2011 book, Concept of Toxic Charity, it highlights the potential for negative consequences of repeatable charitable acts. He famously stated, "Give once and you create an appreciation. Twice, create anticipation. 3 times, expectations. 4 times, entitlement, and 5 times, dependency." This model can be seen in well-intentioned efforts like $1 sterilization drives, which, while aiming to provide immediate support, may unintentionally foster dependency and devalue veterinary care in general. Such initiatives can lead to a reliance on donations rather than promoting the understanding and value of maintaining a healthy animal. Instead of addressing the root issues, these efforts may perpetuate the problem by creating expectations and reducing the perceived importance of responsible pet ownership and veterinary expertise, rather than increasing understanding around the value of having a healthy animal. To address overpopulation effectively, our data reveals that we should be focusing on a balanced approach that involves limiting shelter without expanding the existing capacities, increasing responsible pet ownership, enhancing record keeping, determining threshold levels for desexing, and boosting sterilization efforts to achieve the desexing thresholds in both owned and community-owned dog populations. Despite that fact that Fiji has a number of established animal shelters and rehoming facilities, it is clear from low adoptions and reclaim rates that coupled along with the durations in shelter, that this approach may merely be hiding the issue in shelters rather than addressing it on the streets. We often erroneously attribute the limited efficacy of rehoming systems to poorly resourcing. If we look at the US, where upwards of 350,000 dogs, or 9% of intakes, were euthanized in shelter last year, despite having considerable resources and way more shelter infrastructure than we do in Fiji. For these statistics, it is clear that the Western shelter model may not be an effective long-term strategy for addressing dog overpopulation and improving the welfare of the dogs long-term. Rather than following the Western shelter model, which may not be sustainable or effective in all contexts, we should aim towards a system that community dogs are healthy, sterilized, and managed in harmony with the available capacity for care in the community. This shift will ensure the resources are used effectively and that the value of responsible pet ownership is emphasized. To create such sustainable change for the overpopulation dogs, we need to apply the psychology of behavior change to achieve long-term shift in human behavior. Understanding and influencing behavior change is key to this effort. Several factors influence behavior change, including cultural norms, gender dynamics, income disparities, and GDP considerations. In Fiji's context, these factors are particularly relevant. Cultural norms in Fiji influence how pets are perceived, often viewing them more as functional animals rather than companions. Gender dynamics may determine who in the household is responsible for pet care, with women typically playing the significant role. However, they are not traditionally the financial breadwinners in the household. Income disparities are pronounced, affecting the ability of many Fijians to afford proper pet care. A household's limited finances can cause prioritization of health of the human family members over the pet care. Additionally, Fiji's economic status limits the resource available for widespread welfare initiatives. Addressing these factors through targeted behavior change strategies can help foster responsible pet ownership and manage the overpopulation of dogs more effectively. Managing roaming dog populations in Fiji presents several significant challenges, but a collaborative approach offers a viable path forward. To begin, we need to establish a clear action plan that outlines steps required to implement the proposed solutions. This involves identifying the necessary actions, setting timelines, and allocating responsibilities. Steps to implement solutions includes educational awareness programs, the establishment of proper licensing system, the promotion of responsible pet ownership. Training community members and local authorities is also crucial for this long-term success. Resources needed. To achieve our goals, we must identify and secure the necessary resources. This includes financial support, veterinary supplies, training materials, and human resources. Volunteers and community champions play a crucial role in this. A collaboration with stakeholders. Effective management of roaming dog populations requires a collaboration of various stakeholders. This includes government, non-government organizations, local communities, and community champions. These champions often are influential members of the community with strong social media presence that can help mobilize support and awareness. Potential strategies for collaboration: engage in regular meetings with stakeholders to discuss progress and challenges, share resources and expertise, and coordinate efforts. Joining initiatives in a pilot project can also demonstrate the effectiveness of collective approaches. By fostering the spirit of cooperation and leveraging the strengths of each stakeholder, we can create sustainable and humane solutions to manage the roaming dog population in Fiji. As we look forward, it's important to acknowledge the ongoing challenges and explore variable solutions. Obviously, the challenges are limited resources, with one of the most significant challenges we face is a scarcity of resources. This includes financial constraints, the expense of veterinary supplies, and insufficient personnel to implement these effective changes. Lack of motivation. There's also a noticeable change or lack of drive for behavior change. This encompasses inadequate enforcement and accountability for dog ownership, poor compliance for the Dog Act, and general apathy towards animal welfare. These challenges are compounded by poor ownership practices, insignificant protection of livestock, and inadequate data on both pet and farm animal populations. Some of the solutions that we can enable are collaboration, as mentioned before. Collaboration is key. By working together with all relevant stakeholders, we can actually pool our resources to overcome these. A focus area, prioritizing a specific area, such as education, community engagement, legislative improvements, can also help address the root cause. This includes supporting communities and framework, identifying on-farm solutions, and promoting responsible ownership. Persistence. Achieving long-term success requires persistence. Continuous efforts to improve enforcement, enhance data, and support humane population management strategies are essential. This includes implementing livestock licensing, branding registration, and with annual reporting to improve management and accountability. Our call to action is addressing Fiji's free roaming dog population requires a collective effort from all stakeholders. By improving enforcement, enhancing data collection, and supporting humane dog population management strategies, we can create sustainable solutions. Collaboration between animal welfare organizations, farmers, local communities is essential to bring lasting change in ensuring the well-being of both humans and the animals of Fiji. Jess and I would like to acknowledge Shanil from SPCA Fiji Islands for assisting with the ethics application and survey development. We would also like to thank Naomi and Rahini for assisting in the door-to-door survey. Additionally, we extend our gratitude to the Ministry of Agriculture for their support of this study and our work. Thank you so much for listening, and I'll hand it back to you now.
Thank you so much. That is a huge amount of work, and I think it's so interesting that the work that you're doing over there in a very different country, in a quite a different location, is directly linkable to the work that we need to do here. And so that you're really leading the way in the way of the data collection, the really strategic approach. So thank you. Because we will certainly be, jumping off the back of your work, which is, hopefully something that you can impart to the rest of your team as well, that their work is having ripple effects around the world. We do have a question from Nanda. How did the community go about catching these roaming dogs? If there were spay and release programs. We work with this in the community cat program, but dogs would be even more tricky and potentially dangerous for people with bite risk, etc.
Oh, well, first and foremost, Fiji, just like Australia, is rabies free, so that makes it a lot easier. And Jess can chime in here, but I think also the fact that most of the dogs here are well socialized and understand if they step out of line, unfortunately, they will receive some negative repercussions. So to get a hold of dogs, it's actually not that difficult to handle the roaming dog population here.
Right.
They're not feral by any means.
No. Yeah, I agree with Casey. I think like cat trapping and dog trapping are very different, and there are methods to trapping dogs that work in different contexts and different situations with different levels of socialization of the dog population. So it really depends on the dog population you're dealing with. Definitely in Fiji, there's been a history of using things very similar to the cat traps that you use. It is not the most effective strategy, partially because the public likes to let the dogs out of the traps. And probably if we're going to be successful in actually implementing these programs, we're going to have more, active strategies in especially addressing problem dogs. But I think because a lot of these dogs are being fed and have that human contact behavior and that human feeding tendency, there are opportunities there to be working with these caregivers and getting them to work with us, either to bring the dogs in, or if the dogs are a little, less inclined for socialization, helping us to safely and humanely trap them and get them in for these programs. So I think for us, those are the opportunities that we'd be looking at.
Yeah.
I know that in remote communities here, one of the issues that can be had is that the very social dogs are the easy ones to catch for the desexing program, which leaves the ones that are not so easy to catch to continue to breed, which then changes your, your genetic population of the dogs and their, tendencies to be human social or not. So it's an issue, isn't it?
I think it's something that definitely we're going to need to have more workshop on, and how that small percentage of not friendly and not able to catch. But I don't think it's not a high percentage of the ones that are roaming. Most of the ones that are roaming, like most of the dogs that are out, have a high socialization. And
I probably missed it in the presentation, but do you have an idea of so what you're calling community dogs, which don't have a specific home, but survive between a number of homes, versus those dogs that go home every night?
So going back to the data, Jess, this is more for you, of like our numbers.
Yes. So I think we had in the 30% of households, 37 maybe that owned, and the 54% of households that feed. The hard thing about quantifying the fed dog population is there's going to be probably duplication between households.
Yeah.
These dogs are smart. So they are probably going and being fed at more than one household in a day. And so we don't know if that's the total number of dogs or if some of them are kind of moving between. We do, as a second part of this baseline data collection, have a street dog survey. So basically the team went down through the same exact survey route and counted the number of dogs encountered on the street. We haven't processed all the data, mostly for time reasons, but they were seeing between 140 and 240 dogs over a 13
Yeah, I think the
kilometers.
most was like 245 one day, but yeah.
So
Okay.
13 kilometers of road between 150 and 250 dogs observed. So the
Wow.
road dog population is significant.
Significant.
Being able to actually determine how many of those are community owned, very challenging, but I would say, Casey will probably agree with me, from the numbers that we're seeing, it's very likely that a pretty significant proportion of those are either owned dogs roaming or dogs that are being fed locally and kept in the area.
Yeah. Okay. And in terms of the number of incidents that you have, I know that they've been described in your media, but is anybody keeping data, you know, like are you guys or the Ministry of Health or Ag or whatever? No. Okay. That's a shame,
Ministry of
isn't it?
Agriculture has a very ad hoc data collection with complaints, but it's a lot of it's anecdotal with no like there's no official way to register a complaint or register a bite.
And there hasn't been systems put in place for dog bite reporting, probably out of necessity to prioritize other reporting systems and disease surveillance based on concerns in the area. So there's no centralized kind of information center for that. So this study, coupled with mainstream media, would probably provide the bulk of what is actually known about dog bite injuries in Fiji. But it does.
We do have.
Yeah, go ahead, Case.
They do have statistics on livestock injuries, which, as just said, with what just said, the three of them coupled together probably would give us a better picture.
Sorry, I think I completely dropped.
That's okay. We can't hear you right now, but we'll let you know when we can.
Out there, and I don't know if I'm back yet.
There you are. Yep, you're back. Oh, you're gone.
I'm back? Okay.
Back.
I'm not back on my screen, but okay.
We can hear you.
Okay, excellent. That's the main thing. In terms of the ban for all uses now, or just the non, legal uses?
Paraquat.
Mm,
Paraquat is banned across the board.
right.
But because there
Other
was,
herbicides.
but things like 1080 are not banned across the board. Use
Yeah.
for management is supposed to be regulated by the Ministry of Agriculture and only approved for use by them under situations where there's no other options. But because there is still public access to a lot of the pesticides and herbicides that can do this, there is also a problem with people poisoning, like public members poisoning dogs.
Yes.
Which we saw a lot with paraquat.
Yeah, because that's actually a herbicide, isn't it?
Yeah.
Is that right? Yeah. Okay. You talked about the low numbers that are reclaimed. What do you guys think are the barriers to reclaim?
I think number one, it's hard as a tenant here. A lot of landlords won't allow dogs. That's probably a big priority. So for the towns and the cities like Lautoka and Nandi and Suva, that would be a high reason for abandonment. I think in the villages it's a little bit different, especially more remotely. I also think for monetary reasons, financial reasons for people. And also logistics, if you move from Nandi to Suva, logistics of getting your pet if you don't own a vehicle is also quite difficult.
Yeah.
So,
Yeah. Okay. I love how your data clearly shows that most of the time we as humans know what we should be doing. You know, it's like, I know I need to exercise. I know I need to eat healthy. I know I need to keep my dog in. But actually doing these things, any of these things in our lives, is just not as easy as that, is it? I just think that's so interesting. It doesn't seem to matter where you go in the world. Humans are humans, and doing hard things is hard. And there are a variety of reasons for that. And obviously that gets worse the less money you have, the less, general resources, or, whatever it might be. But it's definitely something that we all need to, like here in Australia, we have a huge, responsible pet ownership push. Yeah, every local government pushes it, every state government pushes it, but people don't often know what it actually means to them, because everyone thinks they're a responsible pet owner. I love my dog. I care for it the same as my parents did, so that must be right. So yeah, it's just really interesting delving now finally in these recent years, people are delving into the human side of things, which is just fascinating, and as you say, is the only way we're going to make great strides in the most resource sort of effective way. And I do love how you mentioned persistence, because you have to be persistent in this field. And we've all been in it for a long time, and we see programs start and programs end, and then people say, oh, it didn't work, and you say, well, okay, it only went for 12 months, like, what do you expect? And we all need to really be, or as I say, more stubborn than everyone else, and really just hang in there and keep doing the work. So I'm very grateful to you both for being persistent and hanging in there and doing the work that you do.
thanks, Nell.
Thank you.
We always say persistence over resistance.
Yeah, I love that. I love it. Thank you. All right. It is, we're actually a little bit early today, which is amazing. So thank you very much. We appreciate your time. Casey, I know you're sitting in a shelter clinic there. You've got stuff to do. Jess, I know you've got probably lots of organisations saying, where is the stuff that you're doing for us? And we appreciate all your work and your time today. So thank you very much, and we look forward to staying in touch and hearing, maybe in a year or two, what the latest install is of what's happening in Fiji.
Thanks so much, Nell.
Thank
Thanks,
you.
everyone. Talk to you soon. Bye.
Bye.
Bye.